So early schooling is very important for any child.
Okay.
Does not matter whether the child because has a diagnosis or does not have a diagnosis. The simple reason is they need to have a schedule.
Mm-hmm.
When you have a school, when you have play, everything has a pattern.
Correct. And after a point of time, I thought, okay, fine. Now, what next? There is a situation in hand. Now, what next? Firstly, acceptance. Secondly, aligning yourself. And thirdly, of course, educating yourself. And fourth, results will come.
The burden of care is something which is the most neglected topic ever.
So, welcome both of you to the Dolly Show today. Navigating autism together, one story at a time. So, here we have with us today a parent and a professional. That is what makes TDS unique. So, here we have Mrs. Parul Singh with us, who is a parent of a child with autism. And we have our therapist, Mrs. Namita, and she is an occupational therapist, a pediatric occupational therapist to be precise. So, welcome both of you, and lovely to have you both. So, yeah, we are going to discuss a few aspects about parenting as well as aspects about occupational therapy today. So, let's just go through a few of the questions. First one being Dr. Namita is a question for you. So, me as well as a lot of parents want to know what exactly is pediatric occupational therapy. So let's start with that.
So occupational therapy is a medical science. It's actually a field in which the major focus is on function. So we aim as therapists to enable function of any individual who's had any kind of an illness or an injury. And our job is to get them back to their original status post-injury. So the major aim is on functional independence. And pediatric occupational therapy becomes a specialization in the field of occupational therapy, which obviously deals with children. So we work with children as young as newborns, right from birth up to the age of 16 years, which is the actual age. So we work with children who have developmental disabilities, which could be autism or any attention issues, behavior issues, handwriting issues, difficulties with play skills, difficulty with managing emotion, social interaction. So there's a huge skill arena which we work with children. And the primary aim is to enable them to function independently in all areas, which is at home, in school, in play areas, and in social settings. So that primarily constitutes our nature of work.
Good. Great. So that brings me to another question. A lot of parents are confused as to, fine, they're diagnosed. Okay. Now, which therapist should they go to? So, what are those signs and symptoms which the parent should look for them to be able to come to an occupational therapist?
So the most important thing, what I feel, is that we're not really looking at a diagnosis. We're not looking at identifying a child having an attention issue and putting it as ADHD, or a child having difficulty with maintaining eye contact as autism. Because the most anxious thing for any parent is getting a diagnosis.
Correct.
So the point is not getting a diagnosis, because the real journey actually starts from when you identify a difficulty. So it can be any difficulty, and believe me, a parent's instinct is never wrong. So if they feel that their child does not give them eye contact, does not sustain eye contact for a longer duration, cannot communicate by the age at which they should be, by 1 year of age they use one word, they do not have a social smile, they cannot play with toys for a longer duration, nor they can interact with other family members, they have a delay in walking, they have difficulty understanding instructions, they can't focus well. So this is the common set of concerns what we normally tell parents to look for. And now with the advent of social media, of course, you have a Google search for everything. So a lot of parents have done the background search. So here we're not looking at a specific diagnosis. We should be aiming to educate parents as to what parenting is all about. So before being a parent, you should actually educate yourself to understand what are the strategies which you need to identify in case if there's a difficulty. And many a times parents are not aware of that.
Correct.
And the most important thing what they hear is a diagnosis, which shatters them even more.
Correct.
And then begins a whole cycle of, what exactly went wrong. The point is, in the whole process, we need to work with the child. Because the final aim, of course, is functional independence, which is what we feel.
Correct.
So, identification at an early age definitely helps parents to gain a better understanding. Educating parents is very important. Supporting them at every stage is very essential. It's just like a lifelong process. The most important thing they need is support.
Correct.
It's very easy said and done. Providing support is equally difficult. For younger ages, when the children are much younger, parents will get a lot of support. But as children start growing older, that is where you can feel a real pinch of concerns and challenges.
So that brings me to Mrs. Parul. So yes, I want to know from you, what were those signs and symptoms that you saw in your child, which get him screened?
My child had firstly, when he was diagnosed with autism was a kind of shock to me because he was talking, doing everything, and when he turned 2 years old, he's actually a case of regression. He stopped talking. He had hardly 80-90 words, which we jotted down everything, what he used to talk, and because therapist or the doctor, I think it was clinical psychologist. Yeah, they asked us to jot down all the words that he used to say and all that. So we did all that. And how he was diagnosed is a very, kind of a very. I was not prepared for it. I just took him to the doctor for he had an upset stomach.
Okay.
And, he, by mistake, he was given 2 vaccinations, together.
Okay.
It was MMR and varicella, which is like a big no-no together, because what doctor told us, it can be, there has to be a gap of at least a month between vaccinations, right? It can be premixed like DPT. It's premixed. It is given in one shot. But 2 vaccinations together cannot be given together. So since then only I started seeing, kind of regressing signs in him. So he stopped looking at me, looking at anybody, stopped responding on his name. And, I thought maybe it's a, kind of a phase that is going on. And one fine day he had an upset stomach, so I took him to the doctor. And then at that time, doctor told me, Parul, it is little, he's little off. He's not responding on his name. And can you just tell me what all have you not noticed? I told him he's spinning the thing. In fact, he asked me, is he doing all these things? I said, yes, he's doing. Of late, he started doing all that. So then he told me, why don't you go to a good place and, get him evaluated. So that was the time he explained me what is it all about. It can be this. So I'm suspecting this autism or ASD. So you better go to a good hospital and just show him and get him evaluated. So that's how our journey, kind of towards exploring autism started.
Good to know. So yes, coming back to you, Dr. Namita. So how does occupational therapy play a role in all these challenges that these children face?
So most of the times what happens is the challenges which are faced are 2 sets. One is the challenges faced by the parents. And the second is the challenges faced by the child.
Correct.
So we have to work on both sets together. Because most of the times what happens is in therapy settings we are more focused on the child. We don't really see the parent.
Exactly.
So we firmly believe that whenever a child comes to us, I think in the first or the second session, you should not be preconceiving thoughts about what the child's behavior could be. It's a new environment.
Yes,
correct.
So we firmly believe that we are absolutely fine with parents coming in the session, sitting. A lot of times parents feel, because they have a thought, that how are we going to be a part of the whole thing? They get really overwhelmed. How are we going to do all this? The point is that the child would be seeing us maybe twice or thrice a week for about 45 minutes.
Correct.
And then it's the onus on the parent.
Yeah.
So you cannot suddenly expect, oh, you have to do everything at home.
Correct.
Because that's a big struggle. If you're a working parent, so the only difference between a working mother and a stay-at-home mother is the place. They both are working at the end of the day. And a parent who is there at home is the one who's going to face the major brunt because they have to go through the whole day.
24 hours.
24
They
hours.
have to live that.
And
True.
it is a joint collaboration.
Mm.
Both the father, the mother have to be equally involved. That is where so these are the challenges which I face as a therapist. After that come the second set of challenges, where because that's the first process. If you do not get that whole process, so it's only involving the mother or only involving the father is not the whole idea. You as a parent want to be really always appreciated. That's what parents look for. It's like, what have you done in the past really doesn't matter. You cannot blame the parent. The blame game is one of the most commonest things which happens in the initial phases.
Is it?
Of course it is. Because it's a
Even,
mother who
yeah,
did it.
even what happens is, you yourself think, what have I done wrong? Is there anything, something went wrong, this happened? Because if you're not aware, see,
Exactly.
a normal family, I consider we are a special family, right? A normal family, they can't understand, it's till the time you're not in that boat, you don't know what is the environment and how, and where we are sailing. So that's what it is. So you have to be in the same boat to know what the special family is going through and what is their mindset when the child is diagnosed, because you were a normal family and you just shifted
It's
the
a
boat.
transition.
Yeah. And you're not aware of what to do next, how we should go about it. And sometimes you are in a denial mode. I have met a couple of parents who are, when I take my child for therapy, they are still not accepting, that there is some issue with their child. So that denial thing is a disaster for the child.
Which is but obvious because it's a fear of the unknown.
Yes.
What will happen to me? Which is a natural question, no? And it's not that it's only every child is special only these days. You have a set of concerns because of the entire family structure changing. So if I'm going to go to work or if I'm going to be away, who's going to take care of my child?
Correct.
So the major struggle starts with, and why the denial is not, it's obviously going to be there because the parents have never been supported all through the journey.
Correct.
You immediately rush in with a diagnosis. Normally, we feel that dealing the diagnosis for a specific duration, until unless the parents have been educated, can make things more better. And another aspect is that when you tell the parent very clearly what are the expectations, you need to have a timeline.
Correct.
6 months down the line, we're looking at this particular area. We're looking at trying to integrate children into a school system. So early schooling is very important for any child.
Okay.
Does not matter whether the child has a diagnosis or does not have a diagnosis. The simple reason is they need to have a schedule. When you have a school, when you have play, everything has a pattern.
Correct.
Then there is organization in their daily living. That's what every parent wants. So once these challenges are taken care of, then we move on to the therapy goals. Because when you see that things are not in the box and everything is left out, what are you going to do?
How are you going to then proceed with the therapy?
Exactly, because then you're not going to see the success. So parent is lost. As much as possible, we try to involve parents when they take the session along with us so that they're comfortable in doing the same activities at home. That's more practical. Rather than, because there's a lot of difference. If I'm talking to you and telling you something, until unless you sit in my seat
Correct.
and put the whole process into action, it's then when you know what are the challenges.
Correct.
And then doing the same at home, because the child is going to be very different at home. In the center, they might be completely in a structured environment.
Because they know that they have to, after a couple of days, they get a hang of it. Yes, here we are to do certain activities.
Correct.
So, but at home, they are more free.
Yeah.
So it's very difficult to get them aligned and get them do something structured.
Correct.
That's what it is.
Correct.
So after facing all these set of challenges, then you actually go into the therapy challenges. So the primary aim of therapy has to be a team approach. And there are 5 members of a team. The child and the parent, of course, are 2. And the other would be the therapists who are working with the child.
This is an interesting.
Yeah,
Plus,
so
if the child is going to school, the teachers
School
who are,
management.
yeah, that is very important.
So, as a therapist, I've always worked with schools primarily to ensure that the school is aware of what the child is doing. So, the parent can collaborate with the school and the therapist so that it becomes easier. Because otherwise, you're going to have like 5 stills on which you've definitely made a house. However, if one still falls, the entire house is going to crumble. So, you have to inspect all the stills at all times. That's it.
So let's just talk about these 5 pillars. Let's go a little deep into that.
So when you are looking at a diagnosis, most of the times, initially when the evaluations happened, a lot of parent support groups were involved. However, gradually with the advent of technology, there are multiple organizations who have help, like Autism Connect has an exhaustive list of people, where you can just go on one website and everything comes under one roof. However, a major challenge which parents struggle with are standalone centers. So some centers might have only speech, some have only OT, some have all therapies together. But at the same time, everything is under one roof. However, all the professionals don't collaborate. So each one collaborating together. So as a parent, she cannot divide her child into 3 parts. No, one for OT, one for speech, one for behavior, or one for education. She has to put all things together. So tomorrow when she goes to the OT and she has a set of activities, she cannot take, okay, now we're going to do OT activities. Now we're going to do speech. It doesn't work that way. So how do you take all those things together? It's like a jigsaw puzzle. You have to fit the pieces at the end of the day. So the most important aspect of the collaborative approach is the parent has to be educated on how to integrate all these therapies together. So that we can provide a similar thing to the schools where they can assist with managing the child. So now, of course, we have shadow teachers. So coordinating with the shadow teacher is also important because otherwise she's going to be on a different platform.
And instead of making the child independent, the child will be more dependent.
Exactly.
And behaviors of a child differ with different individuals.
Correct.
So the more number of people,
You're right, absolutely.
the more behaviors of the child. Children these days are very smart. It doesn't matter whether you have a child on the spectrum or on with attention problems or behavior issues, or for that matter, even hearing issues. Children are very smart. They can very well pick up with whom they can try out their best.
Their way out.
Manipulations.
Correct. So that is where we need to have consistency of behavior. Because the only person to bear the brunt is a parent. Not the therapist. Therapist can receive just twice or thrice in a week.
See here, a parent has to take the charge. Because the parent is there 24/7 with the child. You have to be in charge. You know what is happening with your child. After maybe couple of months or years working with your child, you know that what your child's need right now. So you have to be there and you have to get all the therapists after discussing with them, of course, on the same platform. Okay, this is what is happening in the school. This is what is happening at home. This is what his concerns are. How should we go about? Then distributing it to the, to all the therapists. Okay, OT person is taking care of this thing. And we have to include academics plus speech part also in the OT. Plus OT part in the speech so that the child can sit there and focus on, what is being taught to the child. The same thing, suppose, for an example, if the child is taught what, the concept of what. So it has to be what in the special education, it has to be what in the OT, it has to be what in the speech. All collaborated together.
Correct.
So only then the process will speed up and the child will get the concept easily.
In a holistic way.
Yeah. And it will be more speedy process for the child. Rather than wasting time in OT person is doing something. And obviously, there's a different set of activities that the OT person will do. different set of activities, or what can I say, techniques that a speech person will do. But there are certain things which you need to all have to kind of balance it out and move together. What we want right now. Okay, now what? Then where? Then how?
Yeah.
I mean, just an example. So for everything, we have to teach them. They will not learn it normally. So they will learn. We have to teach everything, all the life skills, everything, all the concepts, all the important concepts. We have to teach them. So we all have to be there, and you have to work with the therapist. I should say every time, every now and then you have to. It is very important to communicate with the therapist. Because they are the ones who will help you, guide you, and tell you how to move forward with this. And then all of you sit together and talk out a plan for your child, which works best for him. And then following that plan religiously for a week or 2 weeks, and then see how the child is progressing. And whether he has reached or she has reached to the goal, or we all, in fact, have reached there.
Yeah.
So that's what it is.
So what I sum up is it's a teamwork,
It's a
as we started.
holistic.
Yes, a holistic teamwork where the parent, all the professionals, all the therapists, and the child. It's a team that has to work, and only then is the outcome that comes. Super. Okay, so now again, I'm a little curious. We were talking about the 5 pillars. So we'll exactly focus, and I want to exactly know those 5 pillars and a bit deeper about it.
So for a child, of course, the first pillar is the parents. So the parents does not mean only the parents, it means the family also. So depending on the kind of a setup, whether you have a joint family or a nuclear family, because both sets come with their set of pros and cons.
Correct.
So it's very important that acceptance of part of the family and educating the family is very essential. I think most of the times that is one of the most neglected things, which starts affecting the whole dynamics of the child's level of performance. Because as a therapist, I have never really functioned on diagnosis. The only job of a diagnosis is that you are 100% sure that what concerns your child is. The diagnosis doesn't make any difference in a parent's life.
Correct.
It only makes a difference when you need concessions in schooling or you need job opportunities, which have to be created at the end of the day. It really doesn't matter. The reason why I feel is nobody functions on functional independence. We all want our children to be very good. We all want them to go to a regular school. But believe me, it is everybody's personal choice, that nobody wants to isolate their children, whether they have means or they don't. But at the same time, we still have to face the struggle of ensuring that they have to do on par with neurotypical children. That is again another challenge.
Yeah.
Unfortunately, we have a system now coming up with the new education policy coming in. We're going to have a lot of changes where children with specific needs. I personally do not want to use the word disability because it does not seem to exist. One. Secondly, they're not special needs. Everybody has special needs.
Yeah.
But these are specific
Somewhere,
needs.
somewhere.
Yes.
The third most important thing is, it is not the ADHD child or the autistic child.
Labels.
I have been, so
No.
it's nothing like the label. It is like, I still remember that dialogue when Amir Khan says, if somebody has anemia, you don't keep on saying, Jay has anemia.
Yeah.
Anemic Jay. You don't say that.
No.
So why autistic Jay?
Yeah. Why that?
So it's not an identity. When I've seen children, I'm still in touch with kids who are about 16, 17 on the spectrum, and they're managing on their own. They have their own set of challenges which they feel. The only thing is those challenges become really apparent. The difference between you and them is that those challenges are identified. A lot of us have sensory issues when we talk about those sensory concerns. But we are not going to tell them, because we will feel that, it's quite exhausted. How can I say that? But I wouldn't be comfortable with bright light. I don't like tags at the back. I don't like anybody touching my face. Those are sensory issues. However, I'm coping up. The only difference between me and them is they have difficulty coping up. So we need to regularize these changes as a part and parcel. Every time you're going to put them under the scanner, it's not going to work.
Correct.
So family support comes here where if the family is educated about the whole process, it becomes easier.
Correct.
You're not facing that struggle of that question mark. Oh, why is she taking her son for therapy or her daughter for therapy? So every day they come with that struggle to the center. Imagine how is the level of compliance going to increase. But on the other hand, a family who says, where I see grandparents coming for therapy sessions and I know this child is really going to improve faster because acceptance is there.
And plus, there are more people,
Correct.
Nuclear
So
family have their own challenges.
The burden of care is something which is the most neglected topic ever. You can run an entire conference on that now. The burden of care is, and I do not want to say that because now it's a very ongoing change happening. And the burden of care is either the mother or the father. So I do have fathers coming in for therapy sessions because mothers are working and they are into jobs where they cannot take a break from work and come on to leave the child therapy session, which is a good thing. However, at the same time, the topic still remains the burden of care. It's only one person. So, not the family. So, it's a first pillar, tilt. The second is, of course, the child. How much are you going to burden the child with therapies?
I don't know.
It's quite a lot. So, the earlier, but then it is intensive care. Because the formative years are the ones which will change everything. So the child needs that focus, but at the same time, they need some time for themselves. You just give them some time where they
need to respect their space.
Correct. Third most important is the school setting. Positive reinforcements in the school make the most. Children should look forward to go to school. So the school counselors, psychologists, if they give a feedback, and by feedback I mean a positive feedback.
Correct.
It cannot be everything negative every time. But if you feel that a school setting does not suit the child's specific needs, then maybe some modifications are needed. And those modifications are not doable, then maybe a school setting environment, which is a more realistic option, could be tested. But that can be after an initial few years of, investing into a neurotypical environment where the child may thrive in a much better way. We don't really know. Because that's always, but it is like until unless you put the child into that situation, how do you think so? So when I hear people inform me, oh, my child does not go to a school. Well, according to Sarva Shikshan Abhiyan, you cannot deny a child entry in a school. So a lot of schools won't say no, but they won't say yes either.
Yes. And even if they say yes, they don't have the, what should I say, set up to handle it.
So we can understand that these infrastructure changes are not always possible. However, there have to be options provided. So at the end of the day, then finally parents only end up searching for choices, where you're looking for a smaller setup. And now with the advent of educational pedagogies which have really changed, there are multiple options, of course, for children. So after the school comes a set of professionals.
Oh, okay.
That is the fourth set.
Okay.
So they come later. Ideally, once these things fall back, because these are major places. It's a fourth set of professionals. Identifying the right professional is very important.
So true.
So you should have an occupational therapist who does occupational therapy. That's important.
Correct.
Whom to go? So should you consult so which professional is right for your child? Parents need to educate.
Correct.
So for example, a developmental pediatrician is going to give you a whole chart-up of what are the level of skills. What is the age of the child, the developmental age. So it could be the speech age as well as the gross motor skills age or the fine motor skills age. So that determination happens, of course, with a diagnosis. A clinical psychologist can help you to identify the diagnosis when you have either consulted a developmental pediatrician, but however, at the same time, if you're looking for a developmental quotient.
Correct.
So, diagnosis provision is also done by clinical psychologists, not that they don't. However, it has to be very cautiously done. You cannot directly give a diagnosis. The younger the child, if you're going to put at risk, is a very subtle way of saying, okay, let me just see, just wait and watch. Based on one evaluation, I personally do not feel that you can give a diagnosis. you need to identify which test is appropriate. Because once the insurance sector enters the country full-fledged into healthcare, you have to be responsible for the test which you have administered. It cannot be like you have gone for X movie and they're playing some other movie. Isn't it?
True.
You're definitely going to ask that why this?
Why?
So as a parent, you need to be able to understand that why this test is going to be done for my child. So that understanding has to be there. So it is very important, as Ms. Parul mentioned, that communication is a key. Only then can you understand. If you need to consult any other profession, for example, if your child has any medical issues, so a lot of times children might have seizures, they might have any behavior concerns, they might have self-stimulation or any kind of behavior which is injurious. Then at times, or there are sleep issues, you may need medications. A lot of parents feel extremely anxious about the fact that what happens if my child is medicated, what are the side effects. The biggest form of medical hazards are cell phones. They have the maximum radiation. It's always given to children at a very young age. Television is another mode. How much time has been spent in front of screens? We can't really warrant. I am not trying to say that children should have a complete no of screen. Because you're a stay-at-home mother. You need to use a washroom. Where is your child going to be? There's no help. Let's face it. It's a very realistic situation. You have no help. What are you going to do as a parent? At least my child is sitting at one place and there's no injury.
Even if you have help, you can't involve child 24/7, fix the puzzles, do this, we can't do that. Okay, and if you leave the child will not do anything, the child will get into sensory play.
So somewhere technology does benefit. But at the same time, the kind of food what they eat. So extremely important. The more junk food, that applies for all children. The more junk food, the more your attention level is going to be affected. Chocolate, sweets, sugar. See, traditionally we've had all these things. It's fine to have once in a week. It's not that you're completely eliminating. But at the same time, look for healthier options. That's something which is very important. So these are more severe hazards than even medications. Because the dosages of medications are really at a very low level. Plus, most of the doctors are going to taper them off at a point in time. But if a medication is going to help your child focus in school, why not?
Yes.
It is it's for optimal functioning. So that's something which is very important. But parent education, as I reiterate, that it's very essential that parents need to be identifying and reading up the correct piece of information. So what they read also has to be clarified. They're definitely going to read up. We have a lot of parents who look for adjunctive therapies. There are a lot of adjunctive therapies. However, the mainstay remains mainstay. It's like if your child is going to have fever, you're immediately going to give medication. Correct. You're not going to wait. Because that is a medical hazard. And it might affect your child's health. So looking for medications, you can actually speak to your developmental pediatrician or your pediatric neurologist. So there are multiple people who work. You have a developmental pediatrician. The most important person is your family physician. Because that is the central point. So I asked parents that, do you have a family physician? The answer is a no. So then you move to the pediatrician. Is there a pediatrician whom you meet? They don't have pediatricians. Is it? We do have a lot of educated parents not having a pediatrician for their child. So they might just go to a regular physician. Fair enough. However, whom to consult when you don't know what to do? So you need to get those basics in place. So a pediatric neurologist is going to look at the medical issues which could be arising. You could also consult a behavior specialist who's going to work on the behavior. However, again, the whole team of professionals has to be on one platform. So at what time was the medication given is important for the occupational therapist and the school teacher and the speech therapist. Because that's how the level of attention is going to change. So they need to know what medication the child is on. Are there any medications taken for any other medical issues? For example, you might also need to consult a a pediatric dentist if there are dental
Yeah.
issues,
Mm.
a pediatric endocrinologist if
Mm.
there are any issues related to thyroid, or there could be any gut issues related. So you need to have the right team of professionals. A nutritionist is very important for most of our children. And a lot of times, parents feel completely out of the box because they're not aware of these. It's not I need to scare the parent, but these are vital things. Most important of all is vision and hearing. Two major evaluations compulsory to be done, just like the vaccination chart. So many times parents don't know because it was never told to them. So if your child cannot hear properly, how is your child going to speak? Correct. If your child cannot see properly, what are they going to respond to a visual information? So this is how the fourth team, that is the fourth stilt, is the set of professionals. And the fifth most important person is the one who's going to coordinate all this. Now what is that? That is going to be whom, which you have to tell. She knows the answer already.
The parent.
Yes. You come back.
So the parent has to be at the
Both
start
sides.
and the end. So they have to,
Correct.
yeah, they are the major pillars.
So in other countries, they have they have social workers who coordinate the whole. They have a nurse who helps with these things. But the population of those countries are dramatically lesser. The therapy services provision is much lesser in other countries as compared to India. We should be lucky because we decide to make a call and next week we're going to get an evaluation. In other countries, you have to wait a good 6 months to get 6 months to 1 year for it.
I heard this. We had a small seminar in London, and there was a parent who came in. I have got an appointment for a diagnosis in the next year. I was shocked to know. So, is what you're discussing as of now.
So we should consider ourselves really privileged enough that we have therapy services, we have facilities, we have a choice to make where to go. It's not like you have just one and you have to go there. You have like 5 options in which to choose. So I think the best option is to make a good use of the therapy services provision. Another most important aspect is the financials because therapy services are very expensive. And with today's advent of the need increasing and number of professionals, because unfortunately the exponential rise in identification has been so much that professionals cannot cope up. Number of professionals are not going to dramatically increase. Correct. But children with specific needs are increasing at an alarming rate.
Yeah, it's 1 in 36 now, according to the CDC, which is.
So CDC has made a lot of changes. They changed the milestones to suit the post-COVID population. However, it's not really going to change the identification process. Parents are much more vigilant. Identification happens early. But many a times what happens is that you feel that, okay, it will be better after a point of time. So you might, go in later. So I've seen children at maybe 12 months of age. But by the time the child is 3, the level of interventions has not been so consistently in place. So the earlier you identify, so we need to really focus on a program where early identification is the key. That reduces the burden of management on part of the parent. And if it is at risk, so whenever we have any questionnaires being administered to parents, we always put it as at risk or maybe at risk. But we want a holistic approach. Whether you receive a diagnosis or you don't, you need to intervene. Because intervention is important.
So, coming to Mrs. Parul, so all this discussion that we have, you already must have gone through this. So, it must be a flashback for you. So, in regards to that, I want to specifically, point out how was your journey in regards to finding the correct therapist, finding the correct school, and then let's come to the next question.
See, it was a challenge for us because I have, this autism word was very new to my world. So when my son was diagnosed with autism, I went crazy searching on and why there is no cure, why there is no this, and beating myself out all the time, why this happened and all that. So, and after a point of time, I thought, okay, fine. Now, what next? There is a situation in hand. Now, what next? So then I started reading couple of books, started reading articles, started approaching people. And of course, from one therapy center to other therapy center, you come across a lot of parents. They share their experiences, who are more experienced at that, who are, who are in this journey much before you. So you get to learn more from them. You get to learn from therapists. And then when you are yourself educated and you feel empowered, and then slowly you come to know once you are aligned, first you have to align yourself to the situation. Then okay, now what is right for my child? That instinct will come, and you will know actually what your child needs and which place is better for the child. This comes to you. If you are empowered, if you know, if you are educated enough about the situation, it automatically comes to you because you are in a situation to take a better decision for your child and for yourself. Firstly, acceptance. Secondly, aligning yourself. And thirdly, of course, educating yourself. And fourth, results will come.
Super. So, to sum this up, it's like I also believe that first the parent, as we say, we see the glass full and we see the glass empty. So if the parent sees the glass full and first himself, the parent is full, so is when the parent will be able to give.
Yes.
So yeah, the parent being so to say calm or very much aware of the situation is pretty much important, and is only when.
But it is a very difficult situation. If the glass is half, 99% of the people will see it's not a full glass full of water, it's half glass. You have to attune yourself to see, yes, because I'm in a different situation. The glass is half full. You have to teach yourself, because we are not taught that in our societies.
Correct.
It's a competitive society. We are not taught that the glass is, half full.
Yeah.
It is always taught, okay, the glass is half empty.
Yeah.
So, first we have to align ourselves.
Correct.
We have to put ourselves in the situation and make us understand, yes, the glass is half full.
Yes.
We have to fill it up more.
Correct.
And
And
that's how
also, the most important thing is empathy, which is lacking tremendously.
Correct.
There's no empathy. It's like you visit a doctor, okay, yes, fine.
they are there, I think, to just tag the child. Every child. Okay, the child is not doing this. Okay, fine. This is They will just
So
keep
what
writing.
happens is that empathy in the medical profession is very important on everybody's part, even as therapists. So we feel that until and unless we get a hang of what's, you're not aware of the other person's situation unless you step in their feet.
Correct.
Or in their shoes, on their feet or in their shoes. The problem is that parents need to highlight. So we have actually transformed the approach where what are your expectations as a parent? What do you want for your child? It's not what I want for her child, because she's the mother who's going to be with him day in and out. Tomorrow when she goes to school, she has to answer on behalf of the child and not on behalf of the therapist. So what does a parent want is also important. So that parent-centric approach of care is very essential in healthcare. So it's not like, yes, some medical issues which require intervention. That of course is the discretion of the therapist. But as a parent, so if she feels that my son should be able to move about in the community independently, as a therapist, I have to give her strategies for this.
Correct.
So then the parent feels valued.
Correct.
Here she doesn't feel valued. It's only like my son is going for therapy. I am taking him. He's doing the activities there. He's coming back. I have to do the things at home. What about me? Who's going to address the challenges?
Yeah.
So an important thing is counseling for the parents.
Very important is what I wanted to also.
And counseling means it's not like just individual counseling.
Yeah.
It is group counseling.
Correct.
Couple counseling is extremely important. Do they really get time for themselves?
Correct, correct. Which is so.
And that is not just because her child has specific needs.
Hmm.
Look at others also.
Yeah.
How many
Yeah,
couples get time?
Exactly. Even us.
So it's not that not everybody goes for counseling. Reason being, the strategic management of situations like in terms of stress is varied.
Correct.
Her levels of stress need a specific medical counseling intervention where she needs assistance as to how to cope up in certain situations. She needs her time, because most of the times moms are labeled, oh my god, how could you do that? You have to be there with the child, but you're a human first, right?
Exactly.
So she needs some time for herself as well. So that's where she needs to be given some choices, or she needs to be even making some choices.
Correct.
That's very essential. Because while doing so, also she has to think twice.
See, yeah. First, you're absolutely right. We have to take charge of our life. If we are, we have taken the charge, then only we can take the charge of the full family.
Correct.
So that's what it is. It's very important to have me time. Me time
True.
is very
So
important
true.
for everyone. And of course, yes, then see, if you are the same thing, if you have time for yourself, then your productivity increases. I think you will be more productive. If you are 50% now, you will be 70, 60, 80, your production will increase, right? Your productivity will increase. However, if you're yourself, because I have seen that phase with me also. That there's no time and, all the time, either I'm busy with my daughter or with the other social affairs and my son, and then all my worries and all the stress of future, and then kind of you are taken aback. Then life becomes hell. So then you have to take charge of yourself. Okay, fine, that's enough. I can't live like this.
True.
So then you have to find your own ways. You need that me time, which is very important. Align yourself and take the charge of the other people. Respecting everybody's space, you cannot take the charge, 100% charge of their 24 hours.
Correct.
Right? You can't do that. You can't dominate them so much because you want everything perfect. You want everything, okay, fine, I want to speed up the process. No, it doesn't work like that. It will eventually, if you are at peace, if you are at calm, everything will fall into place. You will make better decisions. You will make better choices, and the environment in the house will also be happy, lucky, and everybody will enjoy, and everybody will look forward to meet each other. That is more important.
So superbly said. So nice. I mean, yeah. And such a happy moment, that once you said it gave such a nice, good vibe. So, which was really nice. So, yeah, to sum it up, Namita ma'am, we just want those 5 small tips that you would like to give to parents as an occupational therapist.
Most important thing is you have to be a very good observer. Identify what your child likes, what your child does not like. What does your child play with? That's very important because the play structure will actually define your level of skills. So play is the most important thing. The second most important thing is identifying your child's level of behaviors at different times and different settings. Keep a good set of structures as when needed. Identify how to communicate with them in a much easier way rather than having devices. Direct communication is the key to any kind of holistic development. The fourth most important thing is let them take their own decisions at some point of time.
Yes.
So, because you need to treat the child as an individual, not as a kid.
True.
Give them their space. Today's children need a lot of space for themselves, for everything. So I think the more you respect it, the better. And the fifth most important thing is stop comparing. We always compare our child with another child.
True.
Oh, this one got this much, this one is doing these things. What about you? It's like you being told, you being compared. Imagine how you will feel about the same thing. Once they feel that the level of yes, but you have to be firm at times. Spanking is definitely not a good choice. You can be verbal in terms of the way you use your tone and pitch of voice, they need to know that you're an authority.
Hmm.
Somewhere the lines have to be drawn.
Hmm.
Because then the behavior goes overboard,
Hmm.
and you can't really stop a child from doing after you have left them
Hmm.
in an unstructured environment for years.
Yes.
And then you expect structure.
Hmm.
So lay down the boundaries much.
I think it's with any child.
Any child, of course. So this is a general tip
Yeah.
for any kind of a child.
Yeah.
That's very important. Once you put these things in place, and I'm sure all of us don't really do so much,
Yeah.
but at least we can make a attempt to do it.
Effort. Yeah.
Effort. Because efforts do pay at the end of the day.
Definitely. Super. It was amazing talking to both of you today. And I am so privileged to have you both at the Dolly Show today. So thank you. Thank you so much.
Thank you.